to Let's Talk Portsmouth, a new communications venue for Portsmouth residents and others interested in the historic port city. If you are concerned about Portsmouth government news and information, Let's Talk Portsmouth is the podcast for you. Let's Talk Portsmouth airs the first and third Thursday of the month. We will talk city business, including interviews with city administrators, city department and agency directors, community and business partners, and all the people who keep things in motion on a local government scene. Now, here's your host, Sharon Hoggart.
Well, good day to all of you out there in podcast land. This is Let's Talk Portsmouth, the podcast that's all about your local government, community, business, and things that impact city operations. I'm your host, Sharon Hoggart from the Department of Marketing and Communications. On this episode, we're going to have a conversation about COVID-19 and mental health. Yeah, I know you're sick of hearing about COVID-19. We understand, we get it. That's why we invited Mr. Nathan Woodard, Director of Portsmouth Behavioral Healthcare Services, to talk about coping with the stress of a pandemic. Mr. Woodard is a Ph.D. candidate pursuing a degree in counseling and psychological studies. He has worked in the mental health and substance use field, holding various positions for about 28 years. Stay with us. We'll be right back after these messages.
How do airplanes fly? What's in this box? What does this thing do?
Kids are curious about everything, including guns. Learn how to store your gun securely and make your home safer at endfamilyfire.org. Brought to you by End Family Fire, Brady, and the Ad Council.
All right. And we're back. You're listening to Let's Talk Portsmouth. And as promised at the top of the show, joining us today is Mr. Nathan Woodard, who is the Director of Portsmouth Behavioral Healthcare Services. Nathan, thank you for joining us today. Before we start the drill, give us a little more information about your background, professional experience, and maybe include a few of your favorite hobbies. How long have you been with Portsmouth Behavioral Healthcare Services?
Sure. First, I would like to say hello to all of our listeners. Again, my name is Nathan Woodard. I've been with the Portsmouth Behavioral Healthcare Services for approximately 6 months now. I am currently a Ph.D. student at Regent University, pursuing my Ph.D. in counseling and psychological studies. I have a bachelor's in psychology and a master's in community counseling from Norfolk State University. I also have had the opportunity to have several certifications in the field. Currently, I'm a certified substance abuse counselor as well as a certified pre-screener. A couple of hobbies that I have. I love to read. Of course, being a PhD student, it seems like that is one of the things that we do most of the time.
That's
and
right.
I also love to ride my bicycle.
Oh, all righty then. Wonderful. We're so happy you could join us today. So, what's involved in the realm of behavioral healthcare? Give our audience some background on the agency's work.
Well, Portsmouth Behavioral Healthcare Services provide services to persons that are recovering from mental health, substance use, or diagnosed with a developmental or intellectual disability. We provide these services to adults, adolescents, and kids. Some of those services include, but are not limited to, mental health skill building, case management services, psychiatric medication services, therapy, medication assistance for those that have opiate addictions, DD, day support services, as well as crisis services. Our goal and aim is to assist anyone that has one of those disorders and trying to help them to maintain in the community and thrive in their everyday lives.
Mm-hmm. So, Nathan, you're a perfect person to talk to us and talk to our audience out there in podcast land about the mental health perspective when we're dealing with COVID-19. Have you seen a rise in the number of people during the pandemic seeking mental health services, either locally or statewide or whatever?
We certainly have seen an increase in persons seeking mental health services due to the COVID-19 pandemic. Most of the areas that we're seeing an increase are those persons with addictions. Those addictions may be addictions to alcohol as well as opiates. Excuse me. We are also seeing persons that are diagnosed with depression as a result of bereavement associated with the loss of a loved one. Many of us either have had someone that we've lost due to COVID, or we have had a friend lost that we know, or we have seen so much of it on the news and TV that has put us in different places at different times.
Mm-hmm.
So we certainly have seen a huge increase in persons that are in need of services due to COVID.
Mm-hmm. I think you already answered the next question too. What kinds of mental health conditions have surfaced during the pandemic, or are directly related? And so, people who already have issues with substance use, alcoholism, and anything else, they've been really impacted by this pandemic.
Certainly, a lot of folks, again, due to the pandemic, have lost their jobs. And of course, once you lose your job, you have a loss of income. We find folk that have lost their housing, and as a result, they may slide into a depressive stage. And of course, with them being depressed, they become withdrawn from family, from friends. So oftentimes they need some assistance, whether that assistance is counseling, therapy, or medication. Again, also with bereavement, COVID-19 has certainly hit us like a ton of bricks, and we've lost many of our friends and families. So we find a lot of people are suffering as a result of those losses. In return, thankfully, they are seeking assistance from their local mental health authorities or their PCP to assist in those issues that they're experiencing at that time.
Mm-hmm. Nathan, what about isolation? I know during the shutdown of everything, did you see a lot of patients, or you talked to a lot of patients that they just felt so isolated they became depressed?
Well, the part of our population that we saw most of that in is our elderly population.
Mm.
Understanding lots of our elderly folk are living alone or are separated from their families for various reasons. And with the pandemic, that just heightened. Family members weren't able to come and visit. Say if a person was in a nursing facility or some other type of facility, due to the high contagious nature of COVID, many of these places were closed to visitors. So unfortunately, our elderly had to endure this alone oftentimes, only with the staff that worked in those facilities. If they lived alone in the home, a lot of families were very anxious and scared to go and visit their elderly parents in the fear that they will transmit COVID to them. So again, those elderly individuals were left alone. We would call them. We would try to use any other type of virtual devices to connect with them. But of course, we know there is no touch that can substitute for the human touch.
Mm-hmm.
So one big part of our population that we did see suffer from this tremendously was our elderly population.
Mm-hmm. Are there certain mental health conditions that are disproportionately affecting specific populations? And if so, what are those populations and why is this happening?
Well, according to the APA, people from racial and ethnic minority groups are less likely to receive mental health care. For example, in 2015, among adults with mental illness, 48% of whites received mental health services, compared to 31% of blacks and Hispanics and 22% of Asians.
Wow. And you know what? I bet if you look back 10 years, I bet those statistics would be even less for African Americans and other minorities receiving mental health care. That's interesting.
I would certainly agree.
Mm-hmm. Does the research show that people who have recovered from COVID-19 experience mental health conditions afterwards?
Well, many people who recovered from COVID-19 have reported not feeling like themselves prior to contracting COVID. Many folk experience short-term memory loss, confusion, and an inability to concentrate, and just feeling different, not being able to put their fingers on what that difference is. So COVID-19, post-COVID-19 has certainly affected those individuals that have contracted it in many different ways.
Okay. Nathan, stay with us. We're going to take a short commercial break and be right back.
No word in the English language is less convincing than probably.
Are you sure we should get matching tattoos on our first date?
Sure. We'll probably stay together.
Probably? It's been 23 minutes since I ate. I can probably swim.
You should wait 30 minutes.
Okay, now tell me what to do. Cannonball! Cramp! Oh, I have a cramp.
I can probably hit the green from here.
Probably.
Can I get a mulligan?
Ready to go?
Hey, are you sure you're okay to drive?
Yeah, I'm pretty sober. Yeah, I'm probably okay.
Probably okay isn't okay, especially when it comes to drinking and driving. If you're drinking, call a cab, a car, or a friend. Buzzed driving is drunk driving. A message brought to you by NHTSA and the Ad Council.
All right, we're back, and you're listening to Let's Talk Portsmouth. And we've got Nathan Woodard on the line from Portsmouth Behavioral Healthcare Services. Now, let's talk about some of the ways we can help people with all this stress. I know that some people are scared witless, and I'm going to admit on the podcast that I'm one of them. So when it comes to COVID-19, we just, people are just scared. So, say someone has taken every precaution to prevent illness, but remains stressed, afraid, super cautious, or overcautious. What are some of the ways that we can cope with all this stress?
That's a great question. Some of the ways that we recommend individuals to cope with the stress as related to COVID-19 is take a break from watching TV or reading or listening to news stories associated with COVID. Oftentimes you can get yourself inundated to the point that you become afraid of what you're going to hear next or what's happening with COVID. Take a break from social media. It can get you to the point that you're only thinking and talking about COVID and the results of COVID and how it is affecting our communities. Take care of your body. We suggest that some people meditate. Meditation has been shown to help with relaxation and really centering yourself. Try to eat healthy. Try to eat well-balanced meals. Also, try to exercise regularly, which is one thing that I'm trying to do in riding my bike. In exercising, we ask folk to try to find a partner. Have an accountability partner. Say, hey, let's get out and walk today. And that day that you just don't feel like doing so, then your accountability partner was like, come on, you can do it, and vice versa.
Mm-hmm.
Get plenty of sleep. It is recommended that the average adult gets anywhere from 6 to 8 hours of sleep a night. So it's very important for you to get the necessary rest so that your body can replenish and revive itself while you're sleeping. Avoid excessive alcohol, tobacco, and substance use. Oftentimes, we want to do things that will help us to kind of get away from reality, or we think that using such products would help us to relax ourselves. But we certainly want to not use any of these products in excess.
Mm-hmm.
So these are a couple of ways that we will definitely recommend to individuals in trying to cope with the stress that's associated with COVID.
Mm-hmm.
Talk to someone. Find a friend or a family member or someone that you trust in just to have conversations. Let them know how you're feeling. Let them know what you're going through. Being able to connect to your faith-based community. Having conversations with your clergy and with your pastors or your deacons at your church also is a way to vent and allow them to help you deal with that stress that you're going through at that time.
Those are some really good tips. I wish I had talked to you in April of 2020 when I was relying on Facebook to get information. That was not the best thing to do. But anyway, I also read somewhere that if people volunteer, if they're really stressed about COVID and they're worried to death about it, if they reach out and help others during this time, it can help with our own mental health. Was that true?
It is certainly true. One of the things that we really try to press upon individuals is that giving back to the community assists you in having a feeling of self-worth and that you're doing something for your neighbor. And in doing so, that also oftentimes take your mind off of the issues that you're dealing with that are associated with COVID and other stressful events as well. So really being able to volunteer, whether it's at a homeless shelter or at a food bank or at your local school, volunteering and giving back to others is always a great option.
Mm-hmm. When people are really struggling to cope and desperately trying to lead a normal life, but it's not happening, where can they get help?
Well, the first place that I would recommend is at one of your local community services boards or behavioral health authorities. That's a great place to start. Each city within the Commonwealth of Virginia have one. Most of the time, we have persons that's on board and on site 24 hours a day, 7 days a week. So if you need assistance, we're always there. I would also say have a discussion with your primary care physician. Your primary care physician, of course, is primarily there to deal with your physical health. But we need to understand that your mental health directly impacts your physical health and vice versa. So your primary care physician certainly wants to hear from you if you have any stressful issues or dealing with any type of depressive issues, so forth and so on, so they can be able to certainly direct you in where you need to go to get services. Mm-hmm. I would also say talk to your pastor or clergy. Again, for those of us that are connected with the faith-based community, mm-hmm. That is a good way for us not to only connect with them, but to others in our congregation as well. Mm-hmm. We also have a great partner who is called the National Alliance of the Mentally Ill, which is NAMI. They have a website. Their website is www.nami.org. This is a national organization that does advocacy work as well as supportive work to anyone that is recovering from a mental health or substance use disorder.
Okay. Now, you cleared up that last question I had, too. Are there any other resources besides what you've told us that people could connect to if they're still distressed? Any other resources?
I think other resources that you may want to connect to is friends and family. I don't think that I mentioned that much. I think looking at your natural resources or natural connections that you already have is extremely important. And who knows you better than your family? So being able to connect with your family, talk with your family, and really have those conversations on letting them know, how are you doing? What's going on? And I really want to emphasize us doing that with our elderly. As mentioned earlier, oftentimes they are alone, whether it's at home or if they're in a nursing home or other type of facility. It's extremely important for us to reach out to them and reach out to them on a regular basis. So again, I say connecting with friends and family is a great option.
All right, Nathan, hold on. We're going to begin to wrap up this episode of Let's Talk Portsmouth. I want you to hang with us. We have another message from the Ad Council. Stay with us.
So it's too late to start saving for retirement, right?
Not right. Starting to save even in your 50s can really make a difference. At aceyourretirement.org, in just 3 minutes, you'll get a free personalized retirement plan. That's aceyourretirement.org. A message from AARP and the Ad Council.
Nathan, this has been a great conversation and some great information you've shared with us. Thank you for appearing on our podcast. Any last words you want to add?
Well, I also wanted to add, I didn't mention there are some great online tools that can assist with issues that you may be having related to mental health as a result of COVID-19. There's an app that's called Mood Kit that deals with depression, stress, so forth and so on, as well as Talkspace, which is a therapy app that is used nationwide. And last but not least, Headspace. This is a app that will assist you in teaching you how to meditate. I would like to say thank you guys for having me this afternoon. I really appreciate giving the opportunity to speak about mental health and COVID and really being able to connect the dots for many. I think this is extremely important. The one thing that I would like to leave you guys with is understanding that our mental health is just as important as our physical health. So we must take care of both.
Thank you so much. This is really great information. I really appreciate it. We're going to invite you back around the holidays. We can talk about the blues, holiday blues. Thank you so much.
Thank you.
Thank you for downloading and listening to Let's Talk Portsmouth. You can find our podcast wherever you listen to podcasts, including Spotify, Podbean.com, and Amazon Music Audible. The Let's Talk Portsmouth link can also be found on our Facebook and Twitter pages. Share our podcast with your family and friends. New episodes of Let's Talk Portsmouth post every first and third Thursday of the month. Keep downloading and listening. We appreciate you. Talk to you later. We're out of here.
Thanks for listening to Let's Talk Portsmouth, the podcast that's all about the city of Portsmouth. Check out our next episode for more news you can use and information that may just change your perspective. Find our podcast on Apple and Google Podcasts, the Podbean app, Spotify, and iHeartRadio. Until next time, take care.